Thank you, Mr. Chairman. So I share the concerns that have been raised by a number of my colleagues that this administration has spent the first 11 months of this year trying every trick in the book to destroy health insurance system in this country. And Mr. Azar, you're being considered now for the top job to oversee key parts of the Affordable Care Act and Medicaid. So I want to start by asking about a basic principle. Mr. Azar, would you agree that it's important that we have a system that allows for every single American to have access to the kind of coverage they need?
I think we all share the goal that we want all Americans to have access to affordable insurance that they desire.
So is that a yes?
As I framed it, yes.
Okay, good. Here's the problem. Those are the exact words that Dr. Price used during his confirmation hearing before this committee. He sat exactly where you're sitting right now and said exactly that. He pretended that he cared about people being able to get their health care coverage, and then he got confirmed and spent 8 months doing everything he could to take away people's health care coverage and crash the health care system. So I think that's the reason we're trying to be very specific about what it is you will and won't do. So I want to follow up on Senator Murphy and Senator Murray's question. They asked about shortening the time period for the enrollment, and you said you wanted to be very data-driven about that. And you thought maybe there was a data reason for doing that. That is that it was ineffective and that somehow it hadn't worked. So let me ask the question this way. Mr. Azar, if you're confirmed as HHS Secretary, and there are no data showing that cutting the enrollment period improves enrollment, will you commit to going back to a 3-month-long period for health insurance enrollment?
My view would be that if the enrollment period does not make sense and work for the efficacy of the program, for the insurers that have to work in it, and for the beneficiaries, I would certainly be open to changing that back if confirmed as Secretary. I can't commit. I'm not in the government. I can't commit to government action not having seen everything there, but
But that's the question I'm asking. You've used data as an excuse. You said, I care about the facts. I want to be data-driven. You had a good exchange with Senator Alexander about the importance of data. I agree with that. So I'm just asking, if there are no data to support your hypothesis that cutting the time period somehow might improve enrollment, will you commit to going back to the 3-month enrollment period?
I would need to look at the data, and if the data drives in that direction, then I'm going to push to ensure that the program is effective. And if a longer period is needed and effective, I don't know what counterbalancing factors there might be. I'm not on the inside.
So it's not all about data for you then?
There's data, but I don't know what the other elements. I've not seen the decision.
I'll take that as a no. Okay. So let me ask another question. When Secretary Price was in office, he supported Republican bills to repeal major portions of the Affordable Care Act. If confirmed as Secretary, will you oppose such bills?
Senator, I and this administration support legislation that, various forms of legislation that would have a system that leads to more affordable insurance, more choice, and more access. There's not been a support of getting rid of. It's a repeal and replace.
I asked a very specific question because I'm trying to get this. This is what Price said when he was in here. So I'm trying to get a very specific question. Would you publicly oppose Republican bills to repeal the ACA like the ones we've seen so far this year? Or are you saying we should just wait and see what you'll do?
I would work with this Congress and within the administration to build a system that helps people get affordable insurance. You and I will differ fundamentally, Senator, I guarantee you, on what the contours of a system to do that will lead to. So you will not make a commitment to oppose those bills that we've heard so far? All right, let me ask another one. What about turning Medicaid into a block grant? Secretary Price pushed that idea while he was in office. Would you do the same? I have actually said before that I think looking at block granting and empowering states to be fiscal stewards there can be effective. Can be an effective approach. The contours of that, the amount of funding, the size, what the baseline
block
is.
Granting.
I support it as a concept to look at.
Look,
one needs to look at block granting as an abstract. The question is instead, what is the precise program? But the notion of a state being empowered to run a program and having all of the incentives to run an efficient, effective program.
Mr. Azar, you could own up to the fact that you want to cut Medicaid and gut the Affordable Care Act, like every other member of the Trump administration, but you want to smile and pretend otherwise until you get the job, and yet you say exactly the same things that would let you pick up right where Tom Price left off in trying to gut the Affordable Care Act. Tom Price lied through his confirmation hearing, and now you come in here and say the same things he said. No one should be fooled.